Last week, I called upon all Ohioans to wear a mask when they were out in public. The evidence is just abundantly clear. As I said, the jury's back, the verdict's in. Masks work, and particularly when masks are used with the social distancing, the two layers Dr. Acton used to talk about, the Swiss cheese. A couple of those layers on there makes a huge, huge difference. Dr. Robert Redfield, director of the Center for Disease Control and Prevention, said last week, and I quote, "If all of us would put on a face covering now for the next 4 weeks, 6 weeks, we could drive this epidemic to the ground." Very, very strong language. We know that masks do in fact work. If the vast majority of us would wear them, it matters a great, great deal. For the last few weeks, I've been on the phone regularly to our county health commissioners, 113 health commissioners around the state. I've also talked in the last few days to a number of the mayors, a number of our county commissioners. And we do have some good news. And some of the good news is, and this is the map, this is not a new map, this is from last week. We won't change the map until the data is compiled today. But you know, the good news is that in a lot of our red counties, the reporting I'm getting back would indicate that more and more people are wearing masks. So that is a very, very good thing. I want to thank everyone for doing it. I want to thank the retailers who have been involved in encouraging people to do that. So the wearing of masks in the red communities has certainly gone up, and I'm very grateful for that. Our preliminary data indicates, and this is significant, that the rate of increase in new cases in these red counties has slowed. We cannot yet say we're at a plateau, but the rate of increase has certainly slowed. We believe that, at least in part, maybe a lot of this is due to the fact that more people are in fact wearing masks. So we are cautiously optimistic that things in those counties, that we're slowing that curve. Again, not to a plateau yet. Don't want to get over enthusiastic about it, but it looks like the wearing the mask is starting to have some effect. I want to thank everyone again in our red counties for wearing the mask. It is making a difference. Now let's talk about our counties that are yellow and orange levels now. When we look at these counties, and again, some of these may change tomorrow. In fact, we have some indication already in the preliminary data that you're going to see more counties, unfortunately, go red tomorrow. So we'll have some more counties go red, it looks like, and we'll get that final data worked out tonight. But let's talk about these yellow counties, these orange counties. Our goal, obviously, is for those counties not to go red, and that is just vitally important. We know from what's happening nationwide, we know from what medical science tells us now, and we know so much more today than we knew at the beginning of this pandemic. We know that the wearing of masks in those yellow counties and in those orange counties will in fact make a difference and may help those counties not turn red. So doing this in those counties where the threat level is lower at the current point makes sense. It's essential that we wear masks statewide in Ohio to contain the spread of this virus. So therefore, tomorrow at 6 o'clock, tomorrow night, our mask order for people who are out in public will be extended throughout the state of Ohio. So again, that will be at 6 o'clock tomorrow night. Every county in the state of Ohio, people who are out in public should in fact wear a mask. Again, the wearing of the mask plus the social distancing makes a huge, huge difference. So just to reiterate, beginning tomorrow in all counties in Ohio, individuals who are out in public must wear facial coverings when you are in an indoor location that's not a residence, or outdoors, but are unable to maintain 6-foot social distance from people who are not members of your household. And also for waiting for a ride, driving or operating public transportation, such as a taxi, a car service, or a private car used for ride sharing. In all those cases, again, the order is the same as it's been in the past. We now are just extending it to more counties. I also want to emphasize, as we see more and more people wear masks, and there may be some people who do not wear masks, I want to emphasize that if someone has a medical reason for not wearing a mask, they do not have to wear a mask. And I would also urge all my fellow citizens to not be judgmental. If someone is in a store and they do not have a mask now, we should assume that they have some medical problem. We should assume that there is some very legitimate reason why they cannot wear a mask. I would again emphasize this mask order is only for those 10 years of age and older. And again, I will emphasize what the medical experts tell us, that masks are not to be worn by infants. One indicator was certainly not under 2. Someone who is young certainly does not have to wear a mask, and certainly someone who is very young should not have a mask on at all. And again, you can look up that guidance, but we are not requiring anybody to do that. Again, the following do not need to wear a mask. Let me just read it. Those who have a medical condition or a disability, or those who are trying to communicate with someone who has a disability. Second, those who are actively exercising or playing sports. 3, those who officiate at religious services, and this includes anyone who's speaking at a religious service where a mask would impede what they're trying to do. Those who are actively involved in public safety do not have to wear a mask, or those who are actively eating or drinking. Just in conclusion, we've got to get this virus under control. Wearing masks is going to make a difference. It will make a difference in what our fall looks like. What we do between now and the next several weeks will determine what our fall is like. We all want kids to go back to school. We want to see sports. We want to see a lot of different things. We want to, have more opportunities in the fall. And to do that, it's just very important that all Ohioans wear a mask. Continuing on the topic of masks, we've called upon a number of our fellow citizens to help us explain this. We have 2 new commercials that we're going to air right now. They will start today. I think one starts today, the other one starts tomorrow. The Ohio Bureau of Workers' Compensation will again sponsor these ads, which were created in partnership with the Ohio Restaurant Association, Ohio Health, Jobs Ohio, and the Ohio Business Roundtable. The 30-second spots feature real Ohioans explaining to other Ohioans why we should all wear a mask and be careful. Bottom line is we do it to protect our loved ones and coworkers and strangers alike. We do it to protect lives and livelihoods so that we can continue to have an effective and safe economic recovery. We can do 2 things at once. Before we show you the spots, I want to offer special thanks. Again, to Dr. Laura S.B. Bell, again, to restaurant owner Gary Calicote, and Steve Markovich, a former Air National Guardsman and fighter pilot who is CEO of Ohio Health. So, Eric, let's take a look at those two ads.
I wear a mask to keep my grandmother safe.
My dad. My sister, who's immunocompromised.
I wear a mask to protect my coworkers, to make my office safe.
So businesses can stay open and don't close again, and jobs can come back.
I wear a mask to help my favorite restaurant.
To help my favorite store.
To protect my customers.
Please wear a mask in public. It's up to all of us.
And we'll see the next one.
Years ago, I flew combat missions in the Middle East. Now I'm on the front lines of fighting another enemy. And I have a very important message for younger adults. You can carry COVID-19 without even knowing it, and then infect others who aren't as healthy as you, like an older relative or a coworker who is immunocompromised. Please wear a mask in public, protect your family, friends, and coworkers. We can win this battle, but it's up to all of us.